A common mistake that a lot of pregnant women make is to wait too long to start preparing for birth. If you're pregnant, it's best to start preparing as early as possible. And today we're going to go over 5 things that you should do early on in your pregnancy to help ensure that you have a positive, smooth birth experience. I'm Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a family nurse practitioner and midwife.
All right, so the first thing that we're going to talk about, jump right into this, is dealing with your fear of birth now as early on as possible. So here at the Mighty Mama movement, we talk a lot about fear because fear causes a lot of problems during labor and delivery. When you're scared, you are tense. Just imagine when someone scares you all of a sudden, like jumps out and scares you, your whole body tenses up, right? Tension is really bad when you're in labor for many reasons. You're going to have a surge of hormones that you don't want that increase pain. The muscles in your uterus and abdomen are going to be pressing against the nerve endings and making that more painful. And they'll also be kind of pushing up against the uterus that's trying to push your baby out. It's more complicated than that, but that's kind of the overall view. Right. Fear is not good. And if you're scared of how much it's going to hurt, or the complications that could happen, or I don't know, how your birth team is going to interact with you, whatever the fears are, that's going to be an impediment to having a positive birth experience. So one of the main things that we say you should do is become educated, which is what you're doing right now. We also have our free birth class and our comprehensive birth class that teaches women a lot of these things and how to deal with it, because education empowers you, right? And it helps you to avoid a lot of issues because you go into labor knowing how to handle everything, knowing what to expect, and it can just make a big difference. Do you have any other tips for us on, we're not going too deep here, but how do you handle that fear of birth that women, spoken or unspoken, I think usually have?
I think it's learning. It's knowing what to expect. I had a mom once, she was having, I think, her 5th baby. And she was a university professor, so very logical in her thinking. And as she was going through, she was like, oh, okay, this is transition. This is what I will feel during this point. Okay, it's all good. And then she just kept going through labor. And each time she would hit a phase of labor, she would go, okay, I'm in this phase of labor now. And it would the rational mind would be like, this is okay. This is what's supposed to happen. This is doing it right. And that would keep her calm. And I think the biggest reason why a lot of women get an epidural or need pain relief in labor is because of fear. Because we see pain as bad. And many times it is. Mm-hmm. But labor, it's a hard work. And if we can take the normal pain of labor and transfer it into hard work, it's no longer pain. It's running a marathon. And that's what we're doing is we're saying, okay, these things that you're going to be feeling are normal, taking fear out of the picture, which reduces the tension. It's that fear, tension, pain cycle. Mm-hmm. You take out fear, it takes out tension, and your pain disappears.
Yeah.
And so knowledge is what does that. If you don't know what's going to happen, it's like a little kid with their teeth falling out. Have you read the book where the little kid's like, I'm like falling to pieces? Mm-hmm. And then they learn that my teeth are supposed to fall out. It's okay. My hair does come out a little bit, all these different things happen. And the kid's like, oh, I guess this is okay then. Yeah. And then they no longer have that fear. And that's what childbirth education and reading books and watching YouTube all is a part of, is that education. It takes out that fear, that tension, and that pain.
Yeah. Quick side note, if you are pregnant and you want to get that baby out with less pain, listen to this. I'm a mama of 8 and my first 3 births were excruciating. I honestly thought unbearable pain was just part of the deal. But everything changed with my 4th baby when Heather, the same midwife and nurse practitioner you see in these videos, taught me a completely different way to handle labor. I had never heard anything like it, and I ended up dilating to 10 centimeters with 0 pain. After 8 babies, I can tell you this method works. Most mamas never learn these strategies though. Even if they want to avoid an epidural, they worry they won't be able to. That was me. I had done tons of research, but I never found a real method that actually worked, just scattered tips. After learning this, I never considered an epidural again. That's why Heather and I started teaching this, because birth does not have to feel like torture. Our 10-step practically pain-free birth method has helped so many women, like Mumina, who said that her twin birth was way less painful than her first singleton birth because she used this method. If you're curious, click the link below and save your spot in our free online class, How to Give Birth with Practically No Pain. Another big thing that you need to do, and we tell all of our mamas this, is avoid negative birth stories. It's really risky to be randomly watching birth stories on YouTube because you don't know what it's going to be like, what's going to happen, what you're going to see, what might trigger you and scare you. You got to be careful to only be surrounding yourself with positive birth experiences and birth stories. A lot of women, for some reason, love to share their own traumatic birth experience with other pregnant women.
Right.
It's just, I don't know what the deal is, but we always tell you, stop someone. If they're trying to tell you how painful their birth was or how horrible it's going to be, don't. Just stop. Say, I'm sorry, I don't listen to negative birth experiences during pregnancy.
Right.
It can be totally fine to do that after you give birth if you want to listen to whatever birth stories you want to listen to, but not while you're pregnant. You really shouldn't, because it can get inside your mind and increase that fear. And you just don't want that.
Well, and one thing is that what was fearful for one person may not be fearful for you. And so it's important not to hear what their fear is, because that may not be your fear. Someone that's, let's say an IV, someone that's terrified of needles, they're going to look at that and go, oh my gosh, the IV was the scariest part. And you're like, that doesn't scare me at all.
Yeah.
And so, but they're bringing that fear into you. And so it's important not to hear those stories or hear those things, because you can have two women with the exact same birth and one loved it and one hated it. And you're hearing from the woman who hated it, and you may have the exact same birth and go, that was great. I love that. That was so empowering to me.
Well, and you also don't know what preparation that person did for her birth.
Exactly.
What kind of a medical team she had, what interventions that potentially were unnecessary or complications that were created by those interventions. But if you hear, oh, I had this complication and that problem, and you say, oh, what if I do it? Yeah. But you're being proactive about your education, you really might not have to face any of those things, because you are going into your labor and birth more educated and reducing the risk of interventions and complications, and knowing how to handle them and what to expect and how to avoid them whenever possible. And so your birth experience, even if you have similar pregnancies or whatever, could come out completely different, because you don't know all of those factors that they experienced in their birth that you might never even come close to experiencing in your birth.
Exactly. It's like worrying every day that you have all of these chronic diseases.
They do exist. Maybe someday you're going to get one, but are you going to spend your whole life worrying about that?
Exactly.
Yeah.
Don't let it ruin your pregnancy.
So fear is a really big one. If you ignore it, that's not going to help. You do recognize it, try to process through those emotions, and then really, really big is just become educated, which obviously if you're watching this video, you're trying to do. And we have amazing resources that help a lot with that too. So be proactive about that. And we've had so many women come to us and say, I was so scared. Now I've got through your program and I'm just more excited than anything to go into my birth.
The next thing is getting on top of how difficult pregnancy can be on your body. It can be a bit taxing, so we need to have our nutrients at top, nutritional value, and exercising and keeping in shape, because it can be hard on our liver, it can be hard on our kidneys. Our heart actually gets a little bit bigger to compensate, because we are now pumping for two bodies. Mm-hmm. And so if we can stay on top of it, it's a whole lot easier than trying to catch up.
Right. And we do have a whole other video that talks about exercise in pregnancy. And we go more in depth, what you can do, what you shouldn't do, what's ideal, not ideal, etc. We're not going to go into all that in this video, because you can watch that one if that's a topic that you want to go over. But it's so natural for a pregnant woman to not want to move.
Yeah.
I mean, early on you feel sick and maybe you really can't. And then you start getting bigger and more uncomfortable. You're worn out from whatever you're doing during the day more than usual. And so it just feels like I just need to rest, which you do. That's important. But a certain level of physical activity is really important for the health of your pregnancy, the health of your recovery, and then for your actual labor and delivery.
Yeah. It's important to do the chiropractor and stay on top of that rather than trying to fix a problem, but being on top of it. Same with your nutrients. And that can be really hard if you're having morning sickness. I tell people just survive the first trimester. But if this is a pregnancy you're planning, get your nutrition to the top notch before you become pregnant. Get your folic acid, your folate up to the top pure. Get your vitamin D levels high enough. You know, all of these things are so much easier when you don't have morning sickness. So, yeah.
And if you didn't do that prior to your pregnancy, just do it now. Just do the best you can now, preparing from now until you give birth. The third thing that is important to do as early on as you can in pregnancy is to choose the best provider for you and the best location to give birth. We talk a lot about this in a lot of our videos here. We also talk about it in our full course because it's so important that your provider and the place you give birth has a big impact on how your birth goes out, on how your birth plan will be respected and honored, and your risk of complications that are sort of caused a lot of times by interventions. Not always, but that's a factor that can be at play there. So it's really important, and obviously it's easier to switch providers earlier on in pregnancy or to just choose the best one from the get-go, right?
Right. And if you found that you didn't choose the provider that you thought you were getting, you can always change. It can be a little more difficult. Some places it's easier, some places it's a little harder depending on the area that you're in and the availability of providers. So it's never too late, but it will make for a much more pleasant care in your pregnancy if you can choose that early on. And so that's what going back to the first one, if you feel more relaxed at home than you do in the hospital, that's going to take away that fear. And the opposite is true. So choosing your place of birth and your provider early can just put your mind at ease.
Point number 4 is learn how birth actually works. Okay, we talked about this a little bit on fear, that education helps you overcome fears. We just want to go a little bit more in depth about that. If you watch a movie where someone's giving birth, it's going to be a woman screaming, strapped to a bed. It's just
dramatic.
It's dramatic and scary, and it's why I always assume birth has to hurt. I think that's a widespread belief that birth has to be incredibly painful. But again, when you learn more about birth, you learn how to manage the pain, how to reduce the pain. It makes such a difference that it's almost unbelievable. Okay, so I share my story a lot in different places. Just a real recap of it. My first 3 births were very painful, and they were that sort of traditional movie style birth. I had learned the things on the internet. But looking back with everything I know now, I was actually pretty ignorant despite having done a lot of research. And once I learned all the things that we teach here at the Mighty Mama Movement, I was able to have low pain births that were truly practically pain-free because of the education, because of the techniques and the strategies. And everything you can learn. This video in particular, we're talking about things to do early on in your pregnancy. But again, if it's too late for that to be early in your pregnancy, it's okay. Start now. Start wherever you're at. But learn, educate, and prepare during your pregnancy. I know you're probably so busy, but every minute you spend on birth education and preparation will make this birth experience be so different and potentially so much better.
Right. And it's important to understand that it's not Hollywood, like we said, because I'll have dads that contact me and they'll say, my wife had a contraction. And I'm like, okay, there's going to be a lot more of them. But in the movies, she's walking around or she's eating dinner and then she has a contraction and this massive snowball happens and everything goes crazy from one contraction. And that's not how it is. You have a contraction and then you don't, for a while, and then you may have another one, or you may not. And so knowing that, what's going to happen in labor and that it's not all drama, because they're always dramatic in the movies because they want viewers, they want excitement, they want clicks. And so a birth that goes calm and peaceful and nothing goes wrong, who wants to watch that on TV? I mean, pregnant women do, but
right.
but
if
your
can find some
general
videos
viewers,
like that, do that.
right? But your general viewers, they want drama. That's why they're tuning in, is for drama. And so understanding that birth is very different from how it is on TV is important.
Actually, let me give a quick plug for the Mighty Mama Movement, because we do have a Facebook group. It's exclusive to members of the Mighty Mama Movement, but in that group, we have a lot of women who have shared their birth stories, either written or even videos. And it's a great place. If you join our program, you have access to that. And it's such a good resource to find truly positive birth experiences, many of which were practically pain-free, and they come from a perspective of women who are educated and knew what they were doing going in. So that's a really, really great resource.
The last point is nutrition, really getting on top of nutrition. We talked about it a little bit in the other ones, but for instance, skin. You can't reverse flexible or inflexible tissue in 2 weeks. That takes months. And so preparing ahead of time so that you can have tissue that flex, good collagen in it, can reduce stretch marks, and the perineum stretching, all of that is really dependent upon nutrition. There's a bit of genetics in there, can't really change genetics much, but nutrition is a huge, huge key point of this. And that takes months to do.
If you think of an athlete preparing for a really big event, they are going to be having good nutrition the whole time they're training and leading up to the event, because like you said, it's not from one day to the next. Take a few vitamins and boom, I'm ready to go. Especially with the maintaining of healthy tissues, which is, women are always coming to us, we're so worried about, I don't want to tear. Nutrition's a really big thing. And we're not going to go into all the details of what the proper nutrition is. We have other content that covers that. But getting on top of that, and again, getting educated early so you can do those things, is so important.
So a lot of the complications that happen in pregnancy, like preeclampsia, pregnancy-induced hypertension, gestational diabetes, a lot of these things, most of it can be corrected with proper nutrition, or avoided in the first place. It's much easier to avoid it than it is to correct it. And so, like in our practice, we have a very, very low rate of pregnancy-induced hypertension, almost no preeclampsia, very, very little gestational diabetes. Cholestasis is another one. All of these, we have very, very low rates because we work with our moms. Group B strep is another one. Women will test positive at 36 weeks and they say, oh, well, can I correct it before the baby's born? And the honest answer is no, because it comes from the intestines, and it takes months of probiotics and diet correction in order to kind of flip-flop that bacteria in the intestines. It cannot be corrected early. It doesn't mean I don't want them to try, but I've never had anyone be able to correct it that quickly. And so we have moms work from the very beginning of their pregnancy to make sure that at the end of their pregnancy, they don't have group B strep. And that's just one of the examples that we're talking about, is, the nutrition it's just everything in pregnancy.
Mm-hmm. Well, we hope that helped you, that you'll take to heart and take some action on these things to help in your birth preparation. And remember, we do have a free birth class that you can take. There's a link below. It's called How to Give Birth with Practically No Pain. And that's an introduction class to kind of teach you some really foundational information, and also one of the most effective techniques to reduce the pain of contractions. And then we have even more content than that. So keep on learning.